In Crisfield, a small fishing village in the state of Maryland, things were very strange. People began to notice a terrible skin eruption, with large pus-filled blisters. It was a very aggressive type of acne that no one had ever seen before. At first, only a few residents were affected, but in a short time, the situation spread. Jessica Thompson, an 18-year-old girl, was one of the first to show symptoms. I started to get huge pimples on my face, but they weren't like normal teenage acne. They were pus-filled blisters and hurt a lot, Jessica recalled. Tom Williard, a 54-year-old local farmer, was also hit by the strange disease. My face became disfigured. It looked like I had swallowed acid or something. I've never seen anything like it, he said sadly. At first, no one could understand what was causing the outbreak of severe acne, until someone realized that everyone affected drank from the same water source, an old artesian well that supplied much of the village. The local authorities immediately closed the well, but it was too late. Hundreds of people in Crisfield were suffering from aggressive acne, and nothing seemed to alleviate the symptoms. Doctors from the region were called in, but no conventional treatment worked. The situation became desperate, with residents hiding at home because of their terrible appearance. Some even lost their jobs due to the stigma and prejudice. The local economy collapsed, with tourists avoiding Crisfield, which was once a charming coastal village. When all seemed lost, a ray of hope emerged from an unexpected place. Dr. Olatunbosun Jibowu, a Nigerian dermatologist, heard about the strange case in Crisfield. He had developed an innovative technique to treat what he called gravitropic cystic acne in remote African villages. Dr. Jibowu immediately traveled to Maryland, convinced he could help. He presented his technique, which consisted of surgically lancing each blister with a sterilized needle, completely draining the pus, and then applying special ointments and compresses. Initially, Crisfield residents were wary of the radical procedure. But when they saw that the first treated patients began to recover within days, people formed huge lines to be treated by Dr. Jibowu. The doctor worked day and night, for weeks on end, emptying blister after blister from the residents. His technique, although painful, worked miraculously. One by one, people got rid of the terrible acne that had ravaged Crisfield. About 2 months later, the coastal village had fully recovered thanks to the tireless work of Dr. Jibowu. He became a true local hero, being honored with a parade and having a street named after him. The exact cause of the contamination that caused the outbreak was never fully clarified, but it is believed that industrial residues leaked into the groundwater that supplied the old artesian well. Whatever the origin, the most important thing is that Crisfield was living in peace again, thanks to an unlikely savior from the other side of the Atlantic.